Okay. Hello everyone. Thank you for joining. I do welcome you all to ask any questions if you have. There are a few questions which were asked to me on Google form, so I will be answering those questions. But feel free to question anything, any doubts you may have. I will try my best. I also have Tasneem, who is my TA, and she's a nutritionist, and she will help us with some of the technical answer questions, on nutrition. So thank you so much. I think one of the question that I had was regarding a personal question on one of the child who is 6 years old and asking whether the weight of the child is okay or not. Any questions like that, you please feel free to kind of email me directly. I will write my email address. So if you want to kind of have any questions, personal questions, just go ahead and email it to me. I will answer. But mainly, there are a lot of questions on type 1, type 2 nutrients. I will talk in detail about those type 1, type 2 nutrients in my complementary feeding, session. Type 2 nutrients are mainly your growth nutrients. Means, children need those nutrients in the diet on a day-to-day basis to grow. Okay, and what helps basically your protein, your first class protein. I really recommend first class protein. I will try to take one more session on importance of protein in children, specifically for linear growth. Okay, so I will be taking that one session probably in my 10th session. Uh, there are other micronutrients which are important for growth: magnesium, potassium, your sodium, chloride, zinc, sulfur. So of course, I mean, you are watching those tutorials also, but make sure that do look at those recipe videos to understand whether you're getting enough nutrient or not. And these nutrients are not just important for children to grow, but for adults, so that we don't get a lot of metabolic disorders, like we don't want to have diabetes, blood pressure, any of those diseases early on. So make sure that you have you eat nutrient dense recipes, which will prevent you from getting a lot of micronutrient deficiencies. Okay, protein is very important for all of us. I'm getting too many questions on protein. I cannot stress enough, really. Protein is a must. Our diet predominantly is carbohydrate rich diet, so do cut down on carbohydrates, specifically refined carbohydrates. Go more with whole foods. Eat a lot more whole foods. Have millets are better. Of course, millets are also carb rich, but definitely much better than rice and wheat. Include lot more dairy products, even in adult diet, specifically if you're vegetarian, because that's a first class protein. And if you're non-veg, then there is no doubt, have your chicken, fish, meats are good. For vegetarian, of course, another good source of protein is your beans and pulses. Nuts and seeds are also a very good source of protein. And do think of all this food to be included in children's diet also. Under 2 years of age, I don't recommend dairy per se. Dairy products are okay. All right. So do think of dairy products, like in terms of dahi, yogurt, paneer, cheese. Those kind of food you can add in children's diet after 6 months of age. Of course, make sure that it's dietary, diverse diet in children's, meal. You don't need to feed them every 1.5 to 2 hours or so. If children have eaten well, you can kind of give every 3 to 4 hours also. Okay, it depends upon what food child has eaten. So if child has eaten very nutrient dense food and has taken good amount, then you don't have to worry if child takes one meal less. It's more about the nutrient density of food rather than the quantity of food. Okay, so for example, if child had egg, so that one egg will have so many different nutrients, and it's very kind of nutrient dense food. So if a child has one egg, that's pretty good for me. It may not look that big, But if child is small and has one egg in the morning, that's good enough. Okay, so let me see what are the questions. I think all the questions are probably just good afternoon. Yes, good afternoon, all of you. I'm so happy that you're all with me. Let me see what are the other questions I have. Uh, when sodium and potassium can be measured seem to be functional in nature, why are they called type 2? Likewise, selenium and copper seem to be more of type 2 qualities yet under type 1. That's a good question. So sodium and potassium, actually it's part of the sodium potassium pump that the action potential. If you I don't know what is your background, but in physiology we learn about sodium potassium pump, right? And for that, basically, you need enough sodium and potassium in your diet. So if in fact, the children who are severely malnourished, because of this deficient, nutrient, what happens is the sodium potassium pump slows down. Okay, so when the sodium potassium pump slows down, it cannot excrete that sodium from intracellular, from within the cell to outside. So these children have lot more intracellular concentration of sodium in their cells. So this sodium potassium is extremely important. If you don't have, specifically potassium, if you don't have, children will not grow well. These are definitely type 2 nutrient actually. There's another question you have is selenium and copper. Yeah, so selenium and copper, they do copper does get actually stored in the body, in the liver. So generally, in fact, if you have liver, chicken liver, and those are very high in copper. So those are type 1. Type 1 is basically you have a storage. Okay, so type 1 by and large, I'm not saying all of them, by and large they have a good storage. So even if you don't have on a day-to-day basis in your diet, you should be able to manage with the stores. For example, iron, right? So iron does have a store. You will start seeing iron deficiency anemia if you don't have enough iron on a regular basis in your diet. And so initially what happens that iron will come from the storage, and once the storage level goes down, then you will start seeing signs and symptoms of iron deficiency anemia. Okay, so that was question to Roshni. How many eggs are permissible per day? Roshni, that's a good, I think everybody has a lot of questions on that. I personally have minimum 3 to 4 eggs a day. Of course, if you are athlete, so you know that athletes take many more eggs. Of course, there are different school of thought, but I recommend you can easily have kind of 4 to 5 eggs per day. Even egg yolks I recommend, there is no issue. And if you need more protein, you can have a lot more egg whites than egg yellow. But up to 3 to 4, even 5, I think I'm absolutely okay with egg yellows. Up to 5 is absolutely okay. And yes, Roshni, make sure that you have the full egg. If you're having just 3 or 4 eggs, just have full eggs. Don't just have egg white, because egg yellow is extremely high in a lot of nutrients, specifically your fat soluble vitamins. Your retinol, okay, which is a vitamin A, your vitamin D, E, vitamin K. So those are important kind of fat soluble vitamins. Okay. Okay, cholesterol egg is still a big confusion. Yes, Roshni, absolutely. Cholesterol and I will just remind me, Roshni, I will send a lot of articles on cholesterol. There are a lot of links also to YouTube videos where cardiologists themselves are recommending that now we don't need to worry about cholesterol from food. If you don't have enough cholesterol, it will be made in the liver. Okay, so just remember that that thing of high cholesterol causing heart disease. Yes, in the context when you have insulin resistant, that cholesterol will be harmful. But if your insulin level is low, if your fasting insulin level is low, if your triglycerides are low, if your good cholesterol, which is your HDL, is high, then we don't need to worry about cholesterol coming from food. We just want to make sure that it does not get oxidized. Okay, so you don't want to have oxidized cholesterol. So for example, when you cook eggs, just cook it on a slow flame so it does not kind of get burnt. You know, it should not smell egg. If it's smelling, if it has an eggy smell, that means the cholesterol is getting oxidized. So just don't, cook it on a slow gas and you'll be fine. Okay, all right. Hi, Beena. Thank you so much for joining. Beena, if you have any questions, just go ahead and ask. There's another question from Dhrithi. I want to know what, according to you, is the current anemic state of women in India? Absolutely pathetic. Absolutely pathetic, Dhrithi. We work with many states. Not only in women, anemia is very high. It's high in young children also. So in Gujarat, actually 85% children are anemic under 5 years of age. Okay, so anemia is an issue, and what, in my opinion, is that a lot of time we eat food which is high in phytates and oxalates. So these are anti-nutrients which prevents the absorption of iron from the food. So I personally recommend to really think of those cooking techniques which we have shown in tutorials, where you basically do fermentation, do soaking, do sprouting, and that will reduce your phytates and that will improve the absorption iron. One more thing which I am very kind of vocal about is your gut microbiome. So if you have, say, good microbiome, it will prevent a lot of this absorption problem, because when you have a bad bacteria in your gut, it's called dysbiosis. If you have dysbiosis, that means if you have a bad bacteria in your gut, absorption of a lot of nutrients will be affected. Okay, so the way to keep your gut microbiome healthy is by eating a lot more, kind of low starch, low, what do I say, sugar. So don't have sugar, don't have jaggery, don't have fried food which are fried in very high omega-6 seed oils. So if you eat healthy, you'll definitely have a lot more good bacteria, which will immediately improve absorption of not just iron, but it will improve overall absorption of B12, overall absorption of a lot of other nutrients. And B12 actually is produced by some of this gut microbiome. So if you have healthy bacteria, it will help with a lot of other nutrients, not just iron. And if you're non-veg, then of course it's much easier to get heme iron from non-veg food. So your meats are high, your red meats are high on, your heme iron. So to have that, few things you want to avoid. A lot of time I see even young children, they are addicted to tea. Now tea is very high in tannins and a lot of this anti-nutrients which will prevent the absorption of iron. Okay, so just avoid drinking tea and coffee and all that with your breakfast or with a meal which is going to give you high amount of iron. Okay, another thing which I've also noticed that a lot of people do complain of kidney stones and all that. So you want to make sure that you avoid food which are very high, not avoid, but eat in combination with like for example, I'm going to give example of spinach. The spinach is very high in oxalate, so you want to kind of add some food which is high in calcium. Okay, so which will kind of cause a calcium oxalate stone, and that will take away your oxalate from food. It will cause excretion of oxalates. Okay, so you don't develop oxalate stones. And also I prefer that you have spinach at least in cooked form. Don't have it in raw form. That oxalate will get absorbed. And also another thing what you want to do is, even with a lot of the seeds are high in oxalates, specifically sesame seeds. Okay, so when you're adding some sesame seeds in powder form or any of your diet, make sure that you have it with your dahi or buttermilk or any of those calcium sources. Okay, very good. Pooja, there's a lot of government policy program going on for anemia. Still, we have very high count. So, Pooja, same problem as I mentioned. I feel that our food has a lot of anti-nutrients. Okay, those phytates, oxalates, which are preventing absorption. Plus, we're eating food which is very rich in simple sugars. Specifically your sugars that we eat. Fructose, sugars. Which get kind of sugar is very detrimental to gut microbiome. So if I feel that if we decrease our sugar intake, if we decrease our jaggery intake, if we decrease a lot of this food which can cause gut microbiome problem, fried food also is another thing which I don't eat at all, actually, fried food. I prefer more kind of roasted or baked, rather than fried. Okay, is there any role of prebiotic in infants? No. So I don't recommend giving any prebiotic or probiotic actually. Food is the thing. Mother's milk has amazing amount of probiotic as well as prebiotic. Okay, prebiotic is your human milk oligosaccharide. I have a huge lecture coming up in your session 4 or session 5, and I have for almost an hour I've spoken about microbiota which are present in mother's milk and prebiotic which is human milk oligosaccharide. So I've gone very deep into the science. So once you watch that, I will come back on live session and we'll go deep into that. Okay. Another questions you have is there are many policies, government policies, programs. So I think that I've already mentioned. Okay. Any other questions if you have, let me know. Okay, in NFH's chart, how are underweight counts different from wasted one? Aren't both based on weight criteria? Okay, Roshni, so again I'll come back to that weight for height, weight for age and height for age, height for age. I will talk more detail in my last session, but remember that the underweight means weight for age. Okay, so you're looking at basically your X has age and your Y has weight. That's your underweight. For wasting means too thin. Okay, and that is always calculated as per height or length of a child. Okay, so on X you have length or height, on Y you have your weight. Okay, so wasting is basically acute malnutrition. So acute malnutrition is suddenly suppose child is doing well and suddenly child has diarrhea and hasn't eaten for say 1 week, 2 weeks. If child has say pneumonia and hasn't eaten, suddenly you see loss of weight over a period of 1 or 2 weeks. Okay, that is called acute malnutrition. So over a period of like say a few weeks, that suddenly there is loss of weight, or a child has not gained weight over a period of say 3 weeks, 4 weeks. It's small children, they need to gain weight on a day-to-day basis. So even if they don't gain weight for a week or so, immediately you will start seeing them coming down as per length. Now length takes kind of a little bit longer to not to grow. Okay, so what happens normally, they kind of stagnate and then they start falling off the percentile lines. Okay, so those are basically stunting. So so those three points, those three terms I will come back again in my last session and we'll go detail. So do not worry about the wasting and stunting part at this point. Okay, Bhavna, I learned about your this things, your 6-year-old. Please feel free to kind of write to me personally, and I will discuss, for your 6-year-old boy child. Main thing, Bhavna, make sure that you eat lots of good protein-rich food. You give it to him, good protein, good high-quality protein. Okay. Any specific diet we should discuss with pregnant mothers? So in pregnant mothers diet, I'll come back to it. Especially for gestational diabetes. Those are all my last couple of sessions. So, Veena, I will talk about it, and in my next live session, or probably in my third session, I will discuss about gestational diabetes and pregnant mothers, because there's a whole big session, long session on pregnant mothers and nutrition. What could be the reason for constant pain in stomach after eating in small children? My daughter gets pain in stomach immediately for a short while after eating. Okay, so many of the children have gluten sensitivity. Okay, so do kind of take them off gluten for some time and see if there is any improvement or not. But gluten sensitivity I'm seeing very often, so that's why in most of our recipes we have not kept wheat as the ingredient. You must have noticed, in such children you can try different millets. Okay, but Poonam, try that, and if you still have a problem, like definitely write to me on my personal email and I will guide you. When holding the breast for breastfeeding, the mother's thumb and finger should always be at what distance from the nipple? That I will come back, because we have not discussed cross-cradle hold and 45 points as yet. That is coming in session 6. So you will learn that in session number 6. Okay, so I will not discuss that right now. While expression of breast milk, the finger should be away from how much distance? Again, it should be. These are all expression, feeding. All those sessions are coming up. So we will discuss that when you watch those tutorials. All these queries will be taken care of. Okay. I guess you want to learn the whole MIYCF in just 3 sessions. That's not possible. So we'll have to kind of finish watching a lot of those sessions, and we'll discuss that. Okay. Should be another question you have. Should hand be used for hand expression? So of course, I mean, and personally, I feel that manual expression is definitely better. I do see, because in US, a lot of these mothers, they use breast pumps, and I do see a lot of complications with breast pumps. So personally, I prefer that we use manual expression. But of course, if you're going back to work in 2 weeks, 3 weeks, and if you have to remove milk every 2 to 3 hours, then pump does become more convenient. Okay, so it's more of for convenience than anything else. But if you have access, and if you're just away for maybe just 3 4 hours, and if you just need to remove milk just for once, then manual expression works as good. And I don't see much complication with manual expression as I see with pumps. Again, this expression part will come in my 7th session, I think 7th session. So we'll discuss more detail in that. Okay. Does milk in the form of tea or coffee gives the same amount of calcium is equal to amount of plain milk? It should, I think. I think Tasneem will be able to answer this question. But why would you want to take tea or coffee? To be frank, have your milk by itself, because what will happen is that tea and coffee will, I mean, the anti-nutrients which are present in tea and coffee will bind with calcium from milk, so then why would, like, I would just have milk by itself. I do recommend to have cocoa powder without sugar, because cocoa does have a lot of magnesium, which is a type 2 nutrient, so type 2, if you want to have tea, I would prefer green tea or any of those. It will give you a lot more antioxidant. Okay. What do you recommend for saggy breast in terms of position? There are some mothers who cannot see whether a baby latch correctly. Yeah. So here, the best position that I find very comfortable with cross cradle, because what happens in cross cradle, you're holding the breast, kind of you're supporting the breast underneath, and you're lifting it up. Okay, and your baby is in such a position that you can actually see a very good latch. Now again, this I will discuss in session 6. Different techniques of breastfeeding, but for me, kind of cross cradle trumps all, really. Sideline hold is good too, but I prefer that we learn to cross cradle latching first, because that's a little bit more kind of it requires a lot more skills. So once you understand what latches, what is the lining of the baby, once you understand what is the extension of the neck, how deeper the baby should be in the breast. Once you learn all that, through cross cradle hold, then any hold becomes very easy. Okay, but I think, again, I don't want to discuss too much about breastfeeding, because we haven't done it as yet. So you just hold your horses. I will come back to you about about breastfeeding in probably my second live session, because now from 6th session onward, I'll be talking only about breastfeeding holds and techniques and skills. I think I want to keep this whole MIYCF course very, very technical, very kind of practical, because these are the issues that you will face when you visit mothers. So I want to keep it very, very practical, not discussing too much the theoretical part, but definitely we will discuss this more in detail once we learn about it. Okay. A lot of parents start giving sugar and salt with complementary food in spite of countering. What absolutely should be? I've gone through this for almost last 12 13 years. Very, very difficult. What I recommend, that if you follow this mother from pregnancy onward, okay, and if she sees that your advice is really helping with good weight gain at birth, and then your techniques, your skills of teaching mothers on cross cradle hold or any other hold, and you see how babies grow leaps and bounds. So mother has so much faith in you that she will listen to you. Okay, believe me, that faith, it's like us having faith in doctors. We won't have faith in all the doctors, right? We will have faith in doctors whom you feel that, oh, his or her advice is helping, right? So what I feel is that whatever you say it with conviction. And a lot of times they don't listen. That, don't worry about it. I mean, don't give up on it. Just be perseverant. Don't tell mothers what they want to listen. Okay, that one thing I've made sure that I never change my advice depending on what mother wanted to hear. I continued to say what was correct, what was giving me result, and then eventually mothers, when they listened, they started seeing results. Second point I would discuss is positive deviance. So what would happen in the community if one or two children were becoming very healthy, then now these mothers would come to that mother and say, how did your baby become so big and so chubby and so healthy? And then that knowledge kind of passed on, like lateral diffusion we call it, from mother to mother. Okay, so you show one or two results, create your success stories, create before, after, create those, and then you can share this with consent, you can share the stories with other mothers. And another thing which really helped me in my program is using this WHO growth chart, percentile growth chart, because every time when we gave some advice and say mother listened to that advice, so next time when she came, we saw some beautiful weight gain or length gain, and we would show that growth chart to mother, and they were so ecstatic. So I feel that use those kind of skills, how to do behavior change. But behavior change will happen if you see the results. So show results, and then you will see the kind of even improved behavior change. Okay, so show it even just in one or two or three cases, and then pass on that stories to others. Okay, so good question, Survi. Somehow got an impression that being vegetarian I'm losing on a lot of easy source of good nutrients. Roshni. Yeah. So yeah, so there are obviously, as you must have seen some of our tutorials, lots of seafoods are extremely high in type 2 nutrients, even not just type 2 nutrients, but type 1 nutrients also. And it's just a rich source. Like if you look at liver, extremely high source of so many nutrients, eggs again a very high source. But I think if we can even have variety of vegetarian food, only thing is think of those cooking techniques. We will have to reduce the anti-nutrients because we need to prevent those phytates and oxalates, kind of preventing absorption of those minerals, especially zinc, iron, magnesium. So remove those anti-nutrients in the form of those cooking techniques which we have mentioned, and I think we would do fine. But have lot more vegetables, variety of vegetables. We just need lot more variety in Western diet. Okay, because some minerals will, or some nutrients will get from some food, some nutrients will get from some food. Like for example, we will have to have a millet and pulses combination to have all 9 essential amino acids, right? Because we know that your pulses that kind of has very low quantity of methionine. Now methionine is, again I'll be talking about sulfur. So methionine is extremely important as a source of sulfur, and sulfur is important for lot many organosulfur compounds in our body. So again, in vegetarian food, only thing what we need to do is to eat variety of food: seeds, nuts, legumes, millets, leafy vegetable, cruciferous vegetables, of course, one fruit a day. All this different, we have to just eat variety and variety, and we'll probably get but don't forget your first class protein, which is your dairy. I think I do have good amount of dairy products in my diet, because that gives me good first class protein. And we know that from your protein tutorial that first class protein, the absorption is pretty good. Okay, and it has all nine essential amino acids, so we don't have to worry about the combination part. Should we tell them that this one we're using salt and sugar? Absolutely, Surbi, absolutely. I have posted one excellent article on one of the email about American Heart Association. So American Heart Association came up with a statement in 2016. Okay, in that they have specifically mentioned about sugar intake under 2 years of age and its association with metabolic disorders, cardiovascular diseases, type 2 diabetes, hypertension in children when they grow old. Okay, so I've been very strict. In fact, in our program, we haven't used sugar or jaggery for past 15 years. I mean, I've been very strict. Do not have that taste. Do not see if you try food. If you don't have sugar, say for 15 days, and even if you have just regular milk, that milk will taste so sweet, because we have to develop that natural taste, you know. We don't need to add a lot of this salt and a lot of this sugar to have tasty food. You know, we need to teach children also that there are just natural flavors which they need to taste. If we put too much of masala, they will not feel what the carrot tastes like, or what is you know even regular dahi tastes like. You know, so you don't. I don't recommend. In fact, even for adults, I don't recommend sugar or jaggery. You know, if you want to be so once they have sugar, it just, you know, it just they want to have more and more. So what about you? Rupal Dalal. Rupal's iPhone. ये Rupal का iPhone. ब्लूटूथ है ना?
नहीं वाईफाई
मोबाइल हॉटस्पॉट?
हाँ हॉटस्पॉट।
ये हॉटस्पॉट का नहीं है?
आपका हॉटस्पॉट चाहिए?
हाँ मेरे पास है, मेरा तो है, ऑलरेडी है।
ओपन है?
हाँ ओपन है। आया? आ गया?
ऑन है।
Okay. So, okay, sorry about that. We had some internet issue. Okay, so do you suggest, should we, no, I don't recommend adding any alternative. Why do we want to sweeten the food? I don't really understand. Definitely no sweetening of, you know, alternative sweetening, because they cause a gut microbiome problem. Okay, so I definitely don't recommend. What you can do is to just after the meal, maybe child can get one like half a fruit per day, you know, but I like do not sweeten the fruit. We do not need to kind of instill that habit, not a good habit. Why most of the nutrient requirement decreased in recent RDA? I don't know, really. I have no clue. I definitely recommend much higher RDA as per my experience in slums of Mumbai. What I saw that a lot of the children were lacking on many nutrients, and if we were stuck to just the amount which were recommended, children were not growing. Anyway, malnourished children have lot more higher requirement, sometimes 2 to 3 times. Okay, so my, like, even for protein, I have almost 1 gram per kilogram of protein, or sometimes even 1.2 gram per kilogram per protein in a day for myself. So I generally, you know, I feel those RDAs are definitely lower. I agree with you, Poonam. Can you suggest source and importance of iodine in growing children? So after 1 year of age, do iodized salt. Okay, salt, of course, restricted till 1 year of age. Mother's milk has iodine. Okay, so make sure that mother is drinking or having salt, iodized salt. Okay, and it's a type 1 nutrient, so it will get basically secreted in mother's milk. Okay, so make sure that mother's baby get enough mother's milk, and that will suffice till 1 year of age. Okay, and some of this food are also high. Obviously, in India, we don't eat a lot of seaweed, but seaweeds are very high in iodine. Another thing which is important is just seafood. So seafoods are high on you know, just natural iodine. Yeah, I think till 1 year of age, mother's milk should suffice. Okay, thank you, Bella. How to manage fussy eating children? How to ensure that they eat all type of food, especially for 3 to 5 years old kids? Mother complain the kids don't eat. Yes, very true. And I've gone very much in detail about the picky eating. Okay, I feel the picky eating starts from early childhood, because when parents insist that I want to add sugar, I want to add jaggery, I want to give this taste, I want to give that taste, I feel that, you know, when and another thing what I feel that when children ask for something, mothers or families give in very quickly, you know, and they feel that okay, if child does not like it, it's my duty to make something else which child likes. Okay, and I've gone very much in detail about the picky eating in session 9 and 10. so I'll come back to it. But what I recommend is to we have to let children know that who is the boss of the house, not children, mothers, mothers, grandmothers, whoever's cooking, they are the bosses. So I think once children understand that, they will start eating. And I don't recommend substituting. So if children don't eat, do not substitute with something which they like. Many times I see that if children don't eat what is cooked at home, mothers, they give some milk and say, okay, milk to piya, doodh to piya, but that's not the way to kind of help children to learn. You know, what I do, or what I've done with my own child is to I just let her go hungry, just give her water. When she's really hungry, she comes back, and if she knows that she's not going to get any substitute, or she's not going to get food which she likes, she automatically learns to eat whatever she's offered. Okay. Another thing what I also recommend that we also have when I tell parents that if suppose something the child does not like to eat, okay, so at least make a rule that she should try at least 1 teaspoon. Okay, she does not have to kind of even finish that 1 teaspoon, but she has to try. A lot of time what happens when you give it consistently over months, they start liking the taste, that taste develop, and they start liking that kind of particular vegetable or whatever that you want to try. But try to have some set rules. People as people should eat together as a family. A lot of time we have this habit that husband will eat separately, child will eat separately, mother will eat separately. So eat as a family, and do not force feed the child. The child does not want to eat, just give water and let the child kind of sit on the table, but do not force feed. I think force feeding is another poor way of giving kind of making children used to like a lot of foods. If you don't force feed and if you allow child to try on their own, I think they will like it. And it's not necessary to like everything. Okay, but if that rule is set in the house, that just try even 1 teaspoon, and many times they would start liking after some time. Also, do not expose them to a lot of food like potatoes, because once they start liking potatoes, they will not like any other vegetables. So I don't necessarily kind of encourage parents to give too much potatoes as a vegetable. Okay. Okay. Okay, I missed your answer for adding. Okay, thank you, Surbhi. So, breast milk, absolutely. You must kind of tell mother to put breast milk in the food, because breast milk is again has good amount of whey protein, and has all the nutrients that is required to grow. So definitely breast milk. Of course, there are few things which will change, but at least child will get a lot of this minerals and protein. So instead of formula I don't recommend, because it's full of chemicals, it's full of sugar, vegetable oil, a lot of chemicals. So formula for sure no. Okay. Okay. Do you suggest diversity in all meals? Of course, if the baby or we can have some routine is diet chart recommend while we counsel about complete. Absolutely, Surbhi. I will come back to this on session number 9 and 10. Okay, we have created beautiful recipes on different age groups, and dietary diversity is absolutely needed. I recommend all 8 food groups, but if child is vegetarian, minimum 5 food groups for sure. Okay. Many times parents come with issues like my young child eats, he passes stool. Yes, no. So Roshni, there is something called a gastrocolic reflex. Okay, so what happens in young children when they eat, the stomach expands, and that causes basically reflex passing of stool, and that is absolutely normal. Okay, so I would not worry at all. They do pass 2 to 3 stools. You just want to make sure that the stool is not watery, or it's not a hard stool, or there is no change in color, like it should not be black, there should not be any blood, or there should not be a white color. So there are a few things that if you're okay, I mean, you just have to examine. If everything is fine, then passing stool after meals are absolutely normal in children. So I would not worry at all about malabsorption in such cases. Of course, you want to make sure that children are getting nutrient dense food, because that weight gain and length gain is very important. So for me, after 6 months, I focus a lot on length gain, because if children are putting a lot more weight than length, that means children are getting food which are high in energy, not necessarily high in nutrients. Okay, So if children are getting lot more energy dense food, so a lot more rice, lot more carbohydrate, lot more fruits, lot more those kind of sugary fruits, either in the form of glucose or in the form of fructose or sucrose, all those foods will, those are energy dense food. So what happens is that extra energy gets converted into fat in the liver and gets deposited. So then children will start gaining weight, but the length does not grow. For length, you require type 2 nutrients. So remember your type 2 nutrients, your protein, your good fats, your magnesium, potassium, zinc, selenium, sulfur. Selenium is type 1, sorry. So sulfur is important. Apart from growth chart, is any scale to assess efficiency of complementary feeding while baby checkup? Yes, your dietary diversity chart. So just make sure that when you're asking questions, the children are eating various diverse diet. That is very, very important. And growth chart I like because again, Surbhi, you will know whether children are getting nutrient dense food or not. So if you kind of, so every 3 months, if you check length, and if length is not growing, you'll know right away that child is not getting kind of nutrient dense food. So I prefer growth charts at least after 6 months. You can kind of at least minimum once in 3 months. If you have access, and once a month is great, because then you can actually see it whether the child is growing tall or not. Because I feel that BMI issue comes in once we start complementary feeding, because energy dense food is so common in our country. When children, mothers start with rice, they start with the rice. Starch is absolutely devoid of any nutrients. So start with some very, again in our complementary food tutorial, we have mentioned what food to start. Okay, so and those foods are very high again on protein. So if you start with protein rich diet, they will not stagger. Otherwise what will happen, they will you will see stagnation of growth in children who are started on predominantly energy dense food. Okay. uh, how to correct malabsorption during pregnancy? Very difficult. First of all, what I would recommend is to stop a lot of this jaggery and sugar that mothers crave during pregnancy. Lots of laddus are very kind of jaggery based. Avoid fried food, because obviously first 2 3 months they have a lot of nausea, so they don't tend to eat much, but then they crave for a lot of the sweet things, and that messes up gut microbiome. So Twinkle, I'm going to talk about gut microbiome in my session 5, I think. So I will, you will see a lot about kind of what causes malabsorption, what causes leaky gut and all that. For babies especially, very important to start mother's milk right away, because that will prevent lifelong problems. Okay, so focus on your gut microbiome. Do kind of what we'll do, Tasneem can kind of put some research on gut microbiome and how to keep those gut microbiome healthy. So we will put it on our other forums. Dietary diversity chart. Yes, yes. Surbhi, you're jumping very much ahead. These are my 9th and 10th sessions. So we will talk about those dietary diversity charts. So do not worry. Hold your horses. Ma'am, a lot of vegetarian lack in B12. Are there any suggestions vegetarian which you would like to give? Yes. At least have dairy products. Have dahi, have paneer, have lot more other dairy products in one or the other form. If you're not lactose intolerant, then definitely kind of you can have, I'm talking more for older than 2 years old, or mothers who are not giving breast milk for one or the other reason. Those babies will need some amount of dairy, because dairy will give good amount of B12. But yes, keep your gut microbiome healthy. Have a lot more, sprouts, a lot more those kind of, healthy lentils and pulses and beans, which will improve your kind of gut microbiome, and that will increase your B12 also. If mother was deficient in iron during last trimester, do we need to supplement newborn with iron? So in supplementation of newborn in iron is basically depending upon the prematurity. So child is premature, then babies are started on iron right away by a neonatologist. But if baby, what we recommend now, Surbi, is that we recommend doctors to have a delayed cord clamping. Okay, so we tell doctors, unless the cord stops pulsating, you do not cut it. because that means a lot of that cord blood is going into baby, and that extra blood kind of get, that iron can get deposited into liver of the baby. Okay, so if you can kind of convince your gynecologist or obstetrician to not to cut cord right away, that will help babies, and that's a WHO recommendation also. So just make sure that you talk to your gynecologist. Okay, can you please break the myth about what food is good and bad during pregnancy, please? Thank you, Shamla. This I will talk about in my 11th session. I promised you, Shamla, definitely. Okay, because we haven't finished that session, and I don't want to. A lot of myths are broken already in that session, but I will come back to it. But absolutely, as I mentioned, good amount of protein, good fats. Avoid a lot of the seed oils which are very high on omega-6. Have a lot more omega-3, which is in the form of, if you're vegetarian, that of course walnuts and flax seeds. But for non-veg, you can have your fatty fish, which are high in omega. Make sure that mercury is not very high on those fatty fish. Okay. Also coming to B12, can fortified nutritional yeast be added to everything? Yes, of course. I think nutritional yeast will not only help with B12, it will also help with B vitamins, just general B vitamins. So it can definitely help for sure. What about chicken stock cubes added to everything as well? Does it help? Yes, it does help. Only thing you want to make sure that chicken stock cube does not have any of those MSG, because a lot of these vegetable cubes, the stock cubes have MSG. So you want to get it from a kind of authentic dealers, and make sure that they are not high on MSGs, because that will cause a lot more problem. Soya chunk recommended food in infant. The only thing is soya chunk you can, but it's very rubbery. It's very difficult for infant to chew, So that's the only thing. If you can cook it really well and it can kind of really mash it really well, so small amount, absolutely, why not? Absolutely, you can give it. How to change this activity? Subrat, what activity you're talking about? Shamla, is it best to avoid sugars and salt during first year of baby? It seems difficult to convince parents. Yes, Shamla, absolutely. I recommend no sugar and jaggery for first 2 years, not just first 1 year. Salt up to first 1 year. No, I don't recommend salt for only first 1 year. Okay, Shamla, what you can do? I'm going to send you one article which is by American Heart Association. This is the statement given by them, particularly for children under 2 years of age. They have strongly recommended zero sugar for under 2 years of age, because it is strongly associated with cardiovascular disease. Now, if you pass on this information to mothers, when it comes from reliable sources like American Heart Association, they will definitely think about it. So let's just pass on the scientific knowledge to them. We try our best, but a lot of time, when the mothers don't listen, we can keep trying, but don't lose heart. That's the reason that we have created this health spoken tutorial, so that we can pass on this right knowledge to families, and they can make informed decision. It's called informed decision. Means mothers knows that this happens when, if I give sugar jaggery, this is the repercussion, and if she's still doing it, it's called informed decision. So let them make informed decision. Our goal is to, or our duty is to inform them. Whether they want to do it or not, sometimes it's not in our hand, So don't get disheartened, because if you get disheartened, then you won't be able to help many more mothers who would listen to you. Okay, Shamla, so I think that's important. If the mother has some malabsorption of iron in pregnancy, is it possible for breastfeeding may get iron deficiency? Yes, very true. So it will be very true, because these are type 1 nutrients. So if type 1 nutrients are lacking in mothers, it will lack in breast milk also. So that's why we recommend that mothers should continue iron medication for at least 1 year, after she delivers. So that iron supplements are very important for mothers. Now for babies, you can start iron supplements. Normally in the US, we do start around 6 months of age. So we do, even in India actually, this we start iron supplement twice a week, starting from 6 months of age. But what you can really do is to inform mothers to talk to their obstetrician to have that cutting of cord, a little bit later once the pulsation stops. That will help. Okay. Okay, what is the maximum age of breastfeeding to children? And there is no maximum age as far, it depends upon mother. So if she wants to breastfeed the baby even till 4 years, 5 years is okay. provided child is taking good amount of complementary feed and nutrition from home cooked food. Okay, because we do see in many cultures they continue to breastfeed but they don't start complementary feeding, and that's not good, because that will cause weight poor weight gain in children. So mothers can continue as long as possible, but provided that she is giving proper nutritious food from home. Okay. We need to, how many fruits a baby can have through a day, is there any specific? Again, Surbi, I'll be coming back to this complementary feeding in my session 9 and 10. I recommend maybe just one or maximum two fruit, and if child is small, there's just maybe half. But I don't recommend too many fruits, because fruits by and large is eventually fructose. Okay, so we don't want to kind of give too much of that sugar even in the natural form. Okay, so focus on protein part, focus on proteins, and fruit one or two just maybe after meal should be good enough. We need to monitor height, length, but measuring length and height is very subjective. How to manage issue? Yes, so Rupali, very, very important. I'll be talking about how to measure height and length, specifically length, when children are small. So I will kind of talk on technicality of how to do it. You're absolutely right, very difficult in a clinical setting. We used to have two people taking lengths. So that understanding the technicality is really important. Focus on weight, but after 6 months I feel that we should check length also. Okay, when baby denies to receive complementary food, at that time most of the parents offering junk food, especially chocolate, but after that the baby demanding this again and again before starting complementary food. So Subrat, it all depends upon the habit. So if parents kind of are habituated, or children are habituated to get chocolate or biscuits or anything that they want, they will demand. And once they know that the scream helps, so they will start screaming higher and louder, and parents will kind of give in to that demand. So please do not, please from childhood, from 6 months onward, kind of just be strict, kind of have your firm boundary. I think that having boundaries is very, very important for children also. They like it. They may know that, okay, mothers are not doing what they want, but eventually they like it. So that boundary is good, not just for early childhood, but that boundary is good for adolescenthood also. So just create that boundary, okay? Just kind of be firm, be assertive. You know that some foods are not good, not healthy. You would not give it. That's it. There are a few examples that I would give it. In fact, there was one example where, what we were doing is that we would, if child brought any chocolate home from school, we would tell her to put it in the refrigerator, and we would tell her to kind of have it every Sunday. So she would try it, she would remember 1 or 2 Sundays, and then she forgot about those chocolates, because by the time she would wait for Sunday, she lost that kind of habit of having sugar, and once after 2 3 weeks she did not have chocolate. I'm talking about my daughter, and she said, "Mom, this is so sweet. I don't know how people can have such sweet chocolate," right? So it's all about the habit. It's all about your taste development, your taste buds. Okay, so don't expose them to so much of sugar. Okay, all our medical students are taught to increase the calories, calcium, iron by adding jaggery. So we have to start at medical teacher. Absolutely, absolutely medical teacher level. Yeah, unfortunately, that's why we have so much of diabetes and blood pressure and obesity problem. If you look at NFHS 5 data, look at the waist to hip ratio. In Ladakh, almost 94% women have very high waist to hip ratio. Okay, and this is we have to be very, very careful about putting jaggery in anything and everything. Eventually it's all basically, it's coming from canned sugar, so it's all sucrose. If you understand science, you can argue. So just basically argue with your science. Okay, you can have those calcium and iron from other sources which are not very high in carbohydrate. Why do you want to have jaggery? So that's just one thing I want to discuss. Okay, will this recording be available? Yes, I think it's on YouTube, so that YouTube link will be available. Okay, thanks Shyamla. Should vitamin D supplement routinely given to infants? Yes, that's a recommendation by Academy of Pediatrics. So, foreign international units of IU, vitamin D should be given to children. How important is it to check babies developmentally ready for eating solids? Yeah, so by and large, by 6 months, you expose babies. If you're eating, you can basically make child sit next to you. They will start putting hand in the thali. They'll start putting, that dirty hand in the mouth. So, of course, expose them to a lot of this thing of tongue thrusting. Okay, that's fine. But I do recommend to start at the end of 6 months. Because if we wait for too long, those babies we do find have difficulty basically chewing. They have difficulty swallowing. So start at the right age and you will definitely see the results. I don't recommend starting complementary feeding too early on, because mother's milk is very very efficient till 6 months of age. It's really, I mean, some taste here and there is okay. It's not that we want to kind of make baby full with complementary food, but a little bit of tasting here and there, of child putting a finger in the mouth, if she had something in her hand, any say paste and she put in the mouth, that's absolutely fine. But I prefer WHO recommendation of continuing breastfeeding till at least end of 6 months, still breastfeeding till end of 6 months, and then starting complementary feeding, you know, except in babies who are premature. Yeah, Surbhi. So again, I will come back to all your, you have a lot of questions on complementary feeding, Surbhi. Just wait till my 9th and 10th session. We will discuss this at the later live sessions. Uh, Okay, again, questions on complementary feeding, Survey. What should be the position of the baby while feeding, especially under 1 year of age? Anshu, this I will come back, because this is a breastfeeding tutorial, which is, in fact, I have taken a full live session on 45 points of counseling and all the different holes. So you will enjoy this. Actually, you will really enjoy my live sessions. I've gone very much in detail and technicality and everything. So you'll get that answer from my session 6, 7th and 8th. These are the 3 sessions I've kept only for breastfeeding. Okay, and the complementary feeding will start from 9 and 10. So Sudbi, I'll come back to you with all your complementary feeding. You have a lot of questions on complementary feeding, so I'll come back to those questions. Okay, so any other questions, anything else? If you have any questions related to first 3 sessions, on NFHS 4 and NFHS 5 data, as you can see, there is not much improvement in NFHS 5 data. So again, we all have to work very, very hard to pass on this right knowledge. Rather than talking only about exclusive breastfeeding, do talk about early, exclusion, and effective. Effective breastfeeding is very, very important, because unless you have effective breastfeeding, that mother will not continue exclusive breastfeeding, because no mother likes a baby does not put on weight. Okay, so that effectiveness will come after understanding that what is deep attachment. Okay. Do you recommend type 2 nutrient supplements? No, it would be, I'm against most of the supplements. I don't believe in supplements. Okay, God has given an amazing amount of natural food. Okay, so you will see that most of our, I mean, all our tutorials we have not mentioned. Of course, vitamin D, because vitamin D, it is really lacking in babies. So vitamin D recommendation by IAP, I do recommend, and of course iron for young children. But type 2 nutrient supplements, why? Like, why would, yes, for type 2 nutrients for DHA, EPA, though I do recommend fish oil in, in people who are not eating fish. So that is different, because they are not getting those omega-3s, specifically DHA, EPA. But otherwise, for protein, you have amazing, natural food. You have, we'll be talking about magnesium, potassium, sulfur, all those tutorials are coming up. So I don't like supplements. Basically those are made in labs. Those are made in industries, and I don't recommend taking all the supplements. Which oil do you suggest for mothers and infants, in what proportion? So Aisha, personally, I like coconut oil. Okay, basically medium chain triglycerides, so really good, even for babies. For if you're making any cooking, any food, little bit of, I mean, I don't necessarily put too much of oil, but if you want to use some oil, coconut oil is good. If you don't have access to coconut oil, if you don't, and of course virgin coconut oil, but if you don't have access to coconut oil, you can have some maybe a little bit of peanut oil, sesame seed oil, but those are virgin, like we call it kachi ghani. I don't recommend buying filtered oils. Those filtered oils, those are they are they have a lot of chemicals in it. So I prefer, in fact, in children I recommend ghee. Ghee is the best. So just add a little bit of ghee in the khichdi. Then you can put the ghee in whatever dal. So ghee is definitely much safer. Okay. Okay. Should multivitamin supplements given to under 5 children? Rupali, not recommended. You can just give vitamin D. Vitamin D is recommended. And if children are eating, say playing outside, and if while you're massaging the babies, if you can expose the baby to say midday sun for just even 10-15 minutes, that gives them very good dose of vitamin D. But we do recommend vitamin D supplementation for children. Okay, so under 5 children, I don't recommend any other multivitamin supplements. Okay. How can vegetarian pregnant women maintain B12 level? Do you suggest B12 injection or B12 45? What I recommend basically is get it checked. Okay, you get a B12 level check. Tell mother to work on her gut microbiome. Okay, so if the gut microbiome is good, then the absorption will be pretty good. So I don't worry too much about B12. Even in vegetarian mothers, as long as she's eating or dairy products. If she's having paneer, she's having dahi, I think those should be good enough. So I would recommend to check the level and then make a decision. And if she's low, then of course B12 injection would help, because if B12 level is low, then most likely there is a problem with absorption. Okay, whenever there is a problem with absorption, that oral B12 may not help much. Okay, so injections are fine, but let that decision be made by her obstetrician and her gynecologist. Okay, so in that case, rice bran oil may not be a good option for babies. No, Surbi, I don't recommend rice bran oil. And what about olive oil? Olive oil, yeah, if you have access to olive oil, that should be okay. It's a monounsaturated fatty acids, definitely better than PUFAs. PUFA means your polyunsaturated omega-6 rich oils. So olive oil is okay. In India, we don't have access to avocado oil, but in US, we do recommend avocado oil also. A little bit, not much, but best is ghee. So if you can give ghee, that ghee is one of the best kind of fat that you can use for children. It's good in cholesterol. Cholesterol is required for their brain. It's one of the very stable fat, very stable. It's saturated fat. It's very stable, right? So it won't produce a lot of this toxic elements when you heat it up. Okay, so even for our food, I recommend to have bagar or whatever that you do. I prefer that we use ghee, for dals and all. So, okay, so I think our sessions is over. If you have any other questions, do you recommend type 2 nutrient intake in babies daily? Yes, of course, will be you must have seen our tutorial, right? Type 1, type 2. So type 2 nutrient has to be taken in the food form on a day-to-day basis, because it's not stored in the body. It is there in the body in the form of tissue and organs. So your tissue, like for example, your muscle mass, muscle is made up of your type 2, right? So if you don't have your type 2 on a day-to-day basis, it's not stored in the body. So if you don't have a type 2 nutrient in the food, it will come from the muscle mass, and that's how you will start becoming wasted. You will start becoming thin. So and even your bones basically has 50% of bone is made up of protein, right? So make sure that you have your good amount of give children good amount of protein. That will help with linear growth. It will help with lean mass development, and that will help with overall growth. Okay, so definitely type 2 nutrient intake for sure in babies. I'm talking about more than 6 months, because obviously up to 6 months, that type 2 nutrients coming from mother's milk. Should ghee be used for cooking as well? Yes, so you can use ghee for cooking. Okay, so thank you so much. If there are any other questions, go ahead and ask me. And now from next session onward, I'll be talking about gut microbiome, specifically for in that golden hour. Why mother's milk is so important in golden hour. I'll be also talking about brain development in babies. Those are very important sessions. And we will kind of discuss more in detail about breastfeeding and complementary feeding once those sessions are over. Okay, and I'll be coming again in a month time after 3 more sessions are over, and we'll discuss more in detail. If you want me to take any more particular sessions on any topic, let me know. I will try to add in my say session 11, 12. I will try to add some more topics, but if you want any particular topics, okay. So thank you so much, and thank you.